We pay for antibiotics based on the volume that is used, and we want to try to keep that volume as limited as possible, particularly for the really new novel antibiotics for these multi-drug resistant infections, so that preserves their effectiveness. So we need a different way to pay for antibiotics. We need a way that will allow us to pay for the value that they provide to society rather than just paying per use. And I know it's not a legislative hearing, but I'd be remiss if I didn't say the bipartisan PASTEUR Act that Representatives Ferguson and Peters just reintroduced yesterday would set up exactly that kind of subscription model that would allow the federal government to enter into contracts with antimicrobial developers to really pay for the value that these antimicrobial drugs provide, delinked from how much or how little of the drugs are actually used.
Mr. Alderson, I wanted to ask you, in your testimony, you said that pull incentives like subscriptions are now needed. Can you dumb that down for me and tell me what pull incentives and subscriptions are?
Thank you for making the effort to be at this committee today and waving on. Certainly, the language sometimes is too professorial, and I apologize for that. But for antibiotics, we don't really want the drug that sells to 1 million people or 10 million people, because that would represent a public health disaster. The best case is that infection control does a great job and everything else works perfectly, and we only need these new drugs for a small number of patients. Now, in some disease areas, that they would then charge $1 million for that drug for a small number of patients, and that's how the company makes money. In antibiotics, we really don't want the $1 million drug. The PASTEUR Act or subscriptions tries to pay for the value to society for this drug, even if the volume, especially in early years, is quite low.